Living with Carcinophobia, Fear of Cancer Explained. Updated, October 2, 2025 by Dr. Mohammed Hossein Hariri ASL. Time to read, 11 minutes, 42 views, no comments. Table of Contents. Video on carcinophobia or fear of cancer. What is carcinophobia? Carcinophobia versus hypochondria and nossophobia. Common symptoms of carcinophobia. Causes and risk factors behind the fear of cancer. How carcinophobia affects daily life. Diagnosis and when to seek professional help. Effective treatments for carcinophobia. Self-help tips to manage the fear of cancer. Raising awareness, why carcinophobia matters. Carcinophobia, or the fear of developing cancer, is a specific anxiety disorder that affects countless people worldwide. Even minor health issues can trigger overwhelming worry, leaving individuals convinced they might have cancer. This article explores the symptoms, causes, and treatment options for carcinophobia, while raising awareness about its impact on daily life and mental health. Video on carcinophobia or fear of cancer. What is carcinophobia? Carcinophobia, also known as cancer phobia, is an intense and persistent fear of developing cancer, even in the absence of medical evidence or symptoms pointing to the disease. Unlike ordinary concern for health, this phobia goes beyond rational caution and becomes a form of anxiety disorder that can dominate thoughts, behaviors, and lifestyle choices. People struggling with carcinophobia often misinterpret normal bodily sensations, such as fatigue, a cough, or minor aches, as signs of cancer, which can lead to constant worry, repeated medical consultations, or even avoidance of doctors out of fear of receiving bad news. This overwhelming anxiety not only disrupts peace of mind but also negatively affects relationships, productivity, and overall quality of life. Carcinophobia versus hypochondria and nossophobia. Hypochondria definition and meaning in context with images. While carcinophobia is the specific fear of developing cancer, hypochondria, health anxiety, and nossophobia, fear of disease in general, are broader conditions. Hypochondria involves persistent worry about having a serious illness despite medical reassurance, and it can apply to many different diseases, not just cancer. Nossophobia, on the other hand, is the irrational fear of contracting any disease, often triggered by hearing or reading about illnesses. Carcinophobia falls within this spectrum but is more narrowly focused on cancer, making it distinct yet related to both hypochondria and nossophobia in terms of symptoms and underlying anxiety. Common symptoms of carcinophobia. Carcinophobia often manifests through a combination of psychological and physical symptoms that go beyond ordinary health concerns. One of the most common signs is excessive worry about minor bodily changes, such as a headache, a mole, or digestive discomfort, immediately assuming they indicate cancer. This persistent fear can dominate daily thoughts, leading to constant scanning of the body for potential symptoms. Many individuals repeatedly search online for information about cancer or compare their sensations with medical descriptions, which often intensifies their anxiety rather than providing relief. The emotional toll of carcinophobia can also result in difficulty concentrating, irritability, and heightened stress levels. In some cases, the fear triggers physical symptoms such as rapid heartbeat, sweating, muscle tension, or sleep disturbances. Behaviorally, people may visit doctors excessively, demanding repeated tests for reassurance, or conversely, they may avoid medical checkups entirely out of fear that a cancer diagnosis will be confirmed. Over time, these symptoms can create a cycle of anxiety and avoidance that significantly interferes with work, relationships, and overall well-being. Causes and risk factors behind the fear of cancer. Carcinophobia can arise from a variety of psychological, social, and environmental factors. One of the strongest triggers is personal experience, such as witnessing a loved one suffer from or die of cancer. These painful memories can leave a lasting impression, making cancer seem like an inevitable threat rather than a medical condition with variable outcomes. In addition, constant exposure to cancer-related information, through news, social media, or even health campaigns, can reinforce the idea that cancer is widespread and unavoidable, further fueling anxiety in vulnerable individuals. Certain personality traits and mental health conditions can also increase susceptibility to carcinophobia. People with a history of generalized anxiety disorder, obsessive-compulsive tendencies, or health-related perfectionism are more likely to fixate on cancer as a source of fear. A lack of medical knowledge or misinterpretation of bodily signals can heighten this worry, especially when combined with frequent hypochondria or compulsive online health searching. Risk factors may also include traumatic medical experiences, cultural stigmas surrounding cancer, or even genetic predispositions toward heightened anxiety responses. Together, these causes create a fertile ground for the development and persistence of carcinophobia. How carcinophobia affects daily life. Carcinophobia can significantly disrupt the rhythm of daily life by creating a constant state of anxiety and hypervigilance. People living with this fear often monitor their bodies obsessively, interpreting harmless sensations, like a cough, a skin blemish, or fatigue, as possible cancer symptoms. This preoccupation can interfere with concentration at work, reduce productivity, and make it difficult to enjoy hobbies or social interactions. Even routine activities, such as eating certain foods or going outside in the sun, may be avoided due to the belief that they could increase cancer risk. Over time, these behaviors can lead to isolation and a reduced quality of life. Relationships with family and friends may also suffer as carcinophobia becomes more pronounced. Loved ones might feel frustrated or helpless when repeated reassurances fail to ease the person's worries. In severe cases, the fear of cancer may lead to frequent doctor visits, unnecessary medical tests, or financial strain from excessive health checks. Conversely, some individuals avoid doctors altogether, fearing that a medical visit will confirm their worst suspicions. This avoidance can be harmful, as it may delay genuine health care when it is truly needed. Ultimately, carcinophobia traps individuals in a cycle of fear and avoidance, preventing them from living fully and confidently. Diagnosis and when to seek professional help. Carcinophobia is not simply a fleeting worry about health, it is a persistent and overwhelming fear that can interfere with daily functioning. Diagnosis typically involves a thorough evaluation by a mental health professional, such as a psychologist or psychiatrist, who will assess the severity and duration of symptoms. They may explore whether the individual's fear of cancer is disproportionate to actual medical evidence and whether it significantly disrupts work, relationships, or general well-being. In some cases, clinicians may use diagnostic criteria for specific phobias or health anxiety disorders to classify the condition. It is important to seek professional help when the fear of cancer becomes chronic, distressing, or prevents someone from leading a balanced life. Warning signs include constantly checking for cancer symptoms, obsessively researching health information, or avoiding medical appointments altogether. If these behaviors persist and reassurance does not ease the fear, professional support is strongly recommended. Early intervention not only helps in reducing the anxiety but also prevents the phobia from escalating into more severe mental health challenges, such as depression or panic disorders. Effective treatments for carcinophobia. Carcinophobia can be effectively managed through a combination of therapeutic approaches, lifestyle changes, and, in some cases, medication. One of the most common and successful methods is cognitive behavioral therapy, CBT, which helps individuals identify irrational thoughts about cancer and replace them with more balanced, evidence-based beliefs. Exposure therapy, a branch of CBT, may also be used to gradually reduce the fear by helping patients confront anxiety-provoking situations in a safe and controlled environment. In addition, mindfulness-based therapies and relaxation techniques, such as meditation, breathing exercises, and progressive muscle relaxation, can lower overall anxiety levels and make the fear less overwhelming. Best breathing technique for anxiety and hypersensitivity. For individuals with severe or persistent symptoms, mental health professionals may also recommend medications, such as anti-anxiety drugs or antidepressants, to help regulate the brain's response to fear. Alongside professional treatment, adopting healthy lifestyle habits, like regular exercise, balanced nutrition, and adequate sleep, can improve resilience against anxiety. Support groups and psychoeducation are also valuable, as they provide reassurance and allow people to realize they are not alone in their struggles. With the right treatment plan, individuals suffering from carcinophobia can regain control over their thoughts and lead a more fulfilling, less fear-driven life. Self-help tips to manage the fear of cancer. While professional treatment is highly effective, there are also practical steps individuals can take on their own to reduce the grip of carcinophobia. One helpful strategy is to set healthy boundaries with online health information. Constantly searching symptoms on the internet often increases anxiety rather than providing clarity. Instead, it is better to rely on trusted medical resources and limit the time spent researching health issues. Establishing a regular schedule for medical checkups with a trusted doctor can also help, as this ensures that real health concerns are addressed without falling into the trap of constant self-diagnosis. Another useful approach is to develop routines that promote mental balance. Activities such as journaling, practicing gratitude, or engaging in creative hobbies can redirect attention away from fearful thoughts and reinforce a sense of control. Building a strong support system of family, friends, or community groups can also provide reassurance and reduce feelings of isolation. Importantly, learning to recognize and challenge exaggerated thoughts, by asking whether there is concrete evidence behind them, can weaken the cycle of fear. By integrating these self-help strategies into everyday life, individuals can gradually lessen the intensity of carcinophobia and build resilience against health-related anxieties. Raising awareness: why carcinophobia matters. Carcinophobia often goes unrecognized because many people dismiss excessive fear of cancer as normal health concern. However, the reality is that this phobia can deeply affect mental well-being, decision-making, and overall quality of life. By raising awareness, we help individuals understand that constantly fearing cancer is not simply being cautious but may indicate a diagnosable anxiety disorder that deserves attention and support. Recognizing carcinophobia as a real condition also reduces stigma, encouraging more people to seek help without feeling embarrassed or misunderstood. Awareness is equally important at the community and healthcare level. When medical professionals and educators acknowledge carcinophobia, they can provide better guidance, empathy, and resources for those who suffer from it. On a larger scale, public discussions about carcinophobia highlight the importance of balancing cancer education with mental health sensitivity, ensuring that awareness campaigns inform without unintentionally fueling fear. By making carcinophobia a recognized topic of conversation, society can empower individuals to confront their fears, seek appropriate treatment, and move toward healthier, more informed perspectives on cancer and well-being. Share this post. Facebook, Twitter, LinkedIn, Pinterest, Telegram, email. About the author: Dr. Mohammed Hossein Hariri, ASL. Dr. Mohammed Hossein Hariri, ASL is an English and Persian instructor, educator, researcher, inventor, published author, blogger, SEO expert, website developer, entrepreneur, and the creator of LELB Society. He's got a PhD in TEFL, teaching English as a foreign language. Number of posts: 4,200. Related posts: Strategic ways to practice positive affirmations daily. Thriving in life, success and happiness. Best breathing technique for anxiety and hypersensitivity. Thriving in life, success and happiness. The Cobbler Who Pretended to be a Doctor by Aesop for ESL students. English short stories.